So this guy walks into the clinic, sits on my chair. Before I have a chance to ask him anything, he says, "Doc, I've caught 2 trains to come and see you today. I've heard a lot about you. Can you help me?" I said, "Of course, I'm awesome at what I do. I'll try and help you." He said, "All right." I go, "What's wrong with you?" He says, "I've got hallux hallucinations." I was like, "You what?" He says, "I've got hallux hallucinations. I've got pain in my big toe." So I turned around to him and I said, "If you've got hallux hallucinations, you need to see a different kind of health professional altogether. I'm not the person you need to see." It's actually a true story. It happened a few weeks ago. The patient got the diagnosis right, but got the name of the diagnosis wrong. So he had Hallux Limitus, which means you have limited motion in your big toe. This one here, your hallux. Now, when you have got limited motion in your big toe, you can develop a variety of different conditions. Bunions, you can offload to other structures in your forefoot and you can get pain that can affect ligaments, nerves. There is also a study that was done that said if you've got limited motion in your big toe, it can also be a contributing factor for plantar fasciitis. So it can affect a lot of different structures, mainly because when you're walking, all your weight goes through this big toe, and there's a windlass mechanism which basically helps to form the arch, and it relies on motion in your big toe. Now, there's 2 forms of Hallux Limitus. Actually, you can get a structural problem, so you've got a problem in the bones themselves, or there's a functional problem, so there's not a bony block. So when the patient's sitting on the chair, there's a pretty good motion, but when they're walking, there's a functional problem with the Hallux Limitus with this big toe. Hallux Limitus can lead to Hallux Rigidus, which means there's no motion at all, and you've got some serious problems then. I could talk a lot more about Hallux Limitus because the actual biomechanics of the hallux and the effect on all the relating structures in the foot and ankle is immense. And I don't want to get too geeky on you, not in this video. I might get geeky on you in a different video. I have to put my academic hat on. Don't really like have to ruin my hair, but that's another measurement. That's like another video altogether on my vanity. Nevertheless, what I am doing for this patient is the same thing I would do for a lot of patients with this type of condition. He's going to have a custom orthotic. He's also got a massive plantar flex first raise. So his first metatarsal bone, which is this one there, is sitting much lower than the other 4 metatarsals, which is leading to a lot more pressure going on the big toe as well. So I'm going to give him a custom orthotic to offload him to make it a bit more easier. What he's also going to have, and it's an optional treatment option for most patients, but he wanted it because he wanted to reduce the inflammation straight away. So he wanted an injection in the joint, and I'm going to do that. Actually, he's booked in for end of the month because he was going away somewhere. So he's booked in at the end of the month to have that injection, and I'm going to do the injection into that joint itself and to calm down the inflammation within the hallux. Hope you found this interesting. If you've got hallux hallucinations, then you've got issues. However, if you've got hallux limitus, if you've got pain in your big toe, go and see a podiatrist. If you don't want to see me, see anybody. Go and see a health professional who knows what they're talking about and can assess you both structurally and functionally and dynamically and give you a variety of different options. Surgery is an option for hallux limitus and rigidus. Is not something I tend to recommend very often. I try and recommend conservative measures as much as I can. I hope you found this video interesting. Take care. Bye.